I'm sure everyone by now on the planet has heard of weight loss surgery in terms like the gastric sleeve, the gastric bypass, the gastric balloon, or some other iteration of weight loss surgery. Whether it's online or from a friend or family member, TV, or on your social media posts, the topic of weight loss surgery, medically known as bariatric surgery, has entered every household. Well, today I'm going to explain it all: what bariatric surgery is, the commonly performed procedures, how it impacts people's lives, who's a candidate, and so much more. I'm Dr. Rizwan Chaudhry, and for the past 10 years, my professional life has been devoted to the art and science of weight loss, specifically through performing weight loss operations, and then coaching my patients afterwards to maintain the weight off for good. In general terms, bariatric surgery is a procedure in which part of your stomach and/or your upper digestive tract, known as the foregut, is altered in order to reduce caloric intake and to induce a hormonal response by the digestive tract to reduce cravings and to improve your body's metabolism. Metabolism is the body's ability to take the energy you've ingested in the form of food and calories and to break it down into its component parts, such as fatty acids, glucose, and protein, and to remove the excess of it in the form of cellular waste products. This breakdown is known as the catabolic phase of metabolism. Metabolism also has the ability to build and not just break down the food. The building part of it is responsible for energy storage, known as the anabolic phase of metabolism. Today, I'm not going to get into the detailed aspects of metabolism, but I will bring it up to make it a point that weight loss surgery isn't only about reducing calories, but it's also about altering your metabolism in a favorable way. Now, let's get back to the basics of the bariatric procedure. The earliest record of a weight loss operation actually dates back several hundred years. In fact, historical reports claim that the first bariatric surgery was performed in Spain in the 10th century. King Sancho of Leon was reported to be such an obese man that he couldn't walk, ride a horse, or even pick up a sword. He ended up losing his throne due to this, and eventually his grandmother took him to a doctor who literally sutured his lips shut, leaving a slight opening for a straw, and through the straw, the former king could only be fed a liquid diet. So after some time, the king lost half his weight, he was finally able to get back on his horse, and he regained his throne. It's a pretty slick recovery. Even though there have been some other anecdotal reports of weight loss procedures, it wasn't really until the 1990s that bariatric surgery gained popularity. And that was mainly because of the epidemic of obesity that started to take over the US, which we are battling even today. The gold standard procedure, which was first introduced by Dr. Mason of Iowa in 1966, is known as the gastric bypass operation. The Roux-en-Y gastric bypass operation has gone through many iterations since its inception more than 50 years ago. And today it stands out amongst the rest of the bariatric procedures as the standard bearer. Through small keyhole incisions, known as laparoscopic surgery, the abdominal cavity is accessed. The stomach is then reduced in size by creating a gastric pouch about the size of a large egg. The newly formed stomach pouch causes restriction in food intake and also induces a decrease in appetite by decreasing the secretion of ghrelin, a hormone that tells your brain you're hungry. The next aspect of this procedure is called the bypass, in which 5 feet of small intestine is bypassed in order to reduce absorption of food and to increase favorable gastrointestinal hormones such as GLP-1, called glucagon-like peptide 1. GLP-1 is a hormone produced by your body's small intestine, which helps regulate glucose metabolism, and it increases your body's production of insulin. In other words, GLP-1 helps eradicate type 2 diabetes in people with insulin resistance. What you probably don't know is that the popular drugs such as Ozempic, Mounjaro, Wegovy, they all act by trying to mimic the actions of GLP-1 in your body, and that's why they are known as GLP-1 agonists. The gastric bypass surgery, through the rearrangement of your intestinal tract, facilitates your body to produce its own GLP-1 in a controlled fashion, rather than rely on a synthesized drug with major side effects. On average, people lose about 75% of their excess body weight with the gastric bypass, and 3 out of 4 people who have had diabetes no longer have diabetes. And this effect lasts for years after the operation. What's most interesting is that even if people who've had the gastric bypass surgery, if they've gained all their weight back, most of them did not get their diabetes back. And that is due to the metabolic nature of the gastric bypass procedure in optimizing how glucose is handled by your gut. After 5 years, only about 5% of people will have gained weight back that they had lost. At 10 years after surgery, most people will still have kept their weight off. So long term, it's a great operation. Recovery is typically an overnight stay in the hospital, and in some cases, you can be performed as an outpatient surgery, meaning you can go home the same day. And that's a decision your surgeon will make at the time of your operation. Most people are back to work within a week and are able to tolerate soft foods in about a week as well. The risk for any major complications is less than 1%, so it's a very safe operation when performed by a trained surgeon like myself. My vote for second best bariatric operation is the gastric sleeve, also known as the sleeve gastrectomy. Just like the gastric bypass, the gastric sleeve is performed through small keyhole incisions as a laparoscopic approach, and it can also be performed as an outpatient procedure. During the procedure, the greater curvature of the stomach is resected or removed, leaving about 20 to 25% of the native stomach behind. The excess stomach is removed through one of the tiny keyhole incisions. As you can probably guess, the newly formed gastric sleeve reduces your food intake, but it also reduces ghrelin production, which we discussed reduces your appetite. Unlike the gastric bypass, the gastric sleeve doesn't have as much of an impact on GLP-1 hormone, and so those with diabetes will not see an immediate improvement in their sugar levels. However, once people start losing the belly fat or the visceral adiposity, glucose levels after the gastric sleeve will also improve. On average, the gastric bypass is about 10 times more potent or more powerful in treating diabetes than the gastric sleeve. How much weight do people lose with the gastric sleeve? Well, most people will lose about 60 to 65% of their excess body weight, with about a 15 to 20% chance of weight regain in 5 years. Unfortunately, at 10 years, most people have gained a significant amount of their weight back, so weight regain is a lot more common in someone with a gastric sleeve versus a gastric bypass. In another video, I will go into the details of why people gain their weight back after having a weight loss surgery. As far as post-surgical recovery and diet progression go, most people can go back to work in about a week after the gastric sleeve and have a less than 1% chance for major complications, similar to the gastric bypass patients. Now, the reasons for choosing the gastric sleeve versus the gastric bypass, or vice versa, it's a decision that must be made by you and your surgeon given your specific circumstances. With all things being equal and given that there aren't any contraindications, my personal preference is to perform the gastric bypass surgery because of its favorable short-term and long-term benefits. However, there are situations where I believe a gastric sleeve surgery is better for the patient. And like I said, this decision-making process only comes with years of experience. If your bariatric surgeon is pushing you to one operation or the other, make sure you know why that is. I get some clients showing a lot of concern about getting a gastric bypass operation. In my experience, most of the hesitation stems from a perceived notion that the gastric bypass surgery is dangerous or has a higher complication rate. And I believe a lot of this happens to do with the fact that when the gastric bypass was performed first, like 30 years ago as an open operation, it developed a bad reputation. The reason for this was that there were surgeons performing the operation with little to no experience. So the outcomes for these surgeons were inevitably going to be bad. In any field, it takes a few bad apples to make the entire batch go bad. However, in reality, today's gastric bypass operation, when performed by a highly trained surgeon, is a very safe procedure. So if your surgeon hasn't performed hundreds of these surgeries, hasn't been formally trained in a fellowship program, then I would advise to go seek someone who's more experienced. In experienced hands and properly selected patients, the gastric bypass operation will go smoothly and without complication over 99% of the time. In medicine, and especially in surgery, it is extremely important to understand risks versus benefits. For example, if somebody came through the ER with appendicitis and they're becoming septic, which means the infection is now spread to the bloodstream and the entire body, the risk to their life of not undergoing an operation is very high. So in this circumstance, the benefit of an appendectomy, which means removing the appendix, significantly outweighs the risk of leaving it in place. Why? Because leaving an organ causing systemic infection will kill you. The same risk versus benefit thought process is applied to bariatric surgery. We know from multiple studies across multiple continents, not just the US, that an obese person who continues to stay obese will die a lot sooner, more likely to have a major heart attack, stroke, develop cancer than someone who loses their weight. There was a study in Europe that followed thousands of people, known as the Swedish trial, that determined that obese people who underwent bariatric surgery lived between 5 to 20 years longer than those obese people who decided to not have weight loss surgery. So when a client comes to me and asks me if it's worth taking the risk of surgery, for me it's a no-brainer in most circumstances. If you try to lose weight on your own for the last several years and you've basically stayed the same weight or are getting bigger, is it worth the risk of having a heart attack, stroke, or developing cancer in the next few years? Because at the end of the day, there is a timeline in which your body is going to break in one way or the other. Our bodies weren't designed to withstand the deleterious effects of obesity long term. That's why today, if you look around, you rarely see somebody in their 70s who's obese. You just don't survive that long in that condition. So when somebody who weighs about 250 pounds comes to me and hasn't been able to lose weight on their own for the past 10 years despite all their best efforts, and they ask me if surgery is safe, I ask them another question: do you want to live longer and healthier? I personally have thousands of successful client stories, and so this is an obvious reality in my world. And nearly 250,000 people in the US every year undergo these procedures to stave off all these countless diseases associated with obesity. So I encourage every single one of you who is suffering from obesity or knows somebody who is, to do at least their due diligence and to start thinking of being overweight as more of a health concern than just not being able to fit in your favorite pair of pants. Yes, looking good matters because you feel good when you look good, but looking good by losing weight can save your life. If you like this content and if this resonates with you, please like, share, and comment below. You have no idea how many of my clients who say they wish they had known about benefits of weight loss surgery a lot sooner. And if you're interested in a free guide to bariatric surgery, the journey book I give to my clients, please type in free book in the comments below and I'll make sure you receive it. Thanks.